we're going to be talking about walking and how the foot needs to move and the coordinated movement between the foot, the knee, and the hip joint in walking. We talked a little bit about the combination of muscles last time, and this will give you an idea of what the next webinar is going to be about. Remember when I talked about the pairings of the quadriceps, you have the vastus lateralis and the rectus femoris with the medial hamstrings on extension, and on flexion you have the vastus intermedius and medialis with the lateral hamstrings on flexion. What we're going to do is Leah's going to kind of give you a voiceover as we're going through this, and she's going to tell you what she's experiencing with this whole process. When we talk about movement in walking actually starts in the toes. So when your toes are flexed upwards or dorsiflexed, what they'll actually start to do is they'll allow the ankle to plantar flex. So your toes move opposite your ankles. So if we want Leah's knee to extend, or her leg to extend as we are in walking, what we're going to do is I'm going to hold her toes in plantar flexion, which will actually dorsiflex her ankle. And what you're going to start to see here is her leg is going to actually start to extend. Now I'm going to ask Leah what quad muscle she's starting to experience the contraction in.
Lateral.
Okay, on the lateral aspect of her leg. Okay, and what is your pelvis doing at this time?
I've got the posterior tilt.
The posterior tilt, okay. So now Leah's only focusing on her leg extending. She's not actually contracting any of the muscles. So the intention is being set up through the fascia. The ligaments have positioned the hip joint, the sacroiliac joint, the hip joint, the knee joint, the ankle joint, and also the metatarsals and phalanges of her foot. So as you can see, her foot leg is extending, and although I want you to understand, I'm not moving the leg. The muscles are actually creating the pull that we talk about in tensegrity. So the extent, and this is kind of weird, isn't it, Ray? The tensegrity is the pull of the tissue, soft tissue or connective tissue, against the skeleton. Okay, now to flex her knee, all I'm going to do is I'm going to move her toes upward, or in a dorsiflex position. I don't know if you can see it on the video, but her hip joint is actually repositioning itself.
Yeah, my leg is rotating.
Okay, so you feel a medial rotation.
Yeah.
That's the hip joint, the ligaments in the hip joint, releasing and positioning the femur. What do you feel in your pelvis doing now?
It's going forward anterior.
It's going towards an anterior tilt. Okay, which hamstrings do you feel engaging now? Okay, so they're pulling, right?
Yeah. Yeah, this is loosened up.
Okay. What do you feel in the medial quads doing?
That's tightening.
That's tightening, because what that's doing is the medial quads are holding